Hello, my name is Hannah. I'm going to be performing my colostomy care skills video today. First, I'm going to start by performing hand hygiene and pulling my patient's curtain closed for privacy. Hi ma'am, my name is Hannah. I'm going to be changing your old colostomy bag out for a new one. I'm going to go ahead and check my patient's wristband, name, medical record number, and date of birth. And once I've verified that that is my patient, we're going to go ahead and get started. So first I'm going to start by putting gloves on, clean gloves. And once I have my clean gloves on, we will dispose of the contents in the pouch, measuring it if needed. And once we have measured the contents in the pouch, we're going to go ahead and assess the bag for any leaks or anything like that. It doesn't look like it was leaking, so we're going to go ahead and remove it, just gently and slowly pulling off the old adhesive here. I want to be careful because of the skin. And we're going to go ahead and dispose of this in a waterproof bag. So once we've done that, I'm going to take my gloves off. And I'm going to go ahead and perform hand hygiene. And we will get new gloves. Once I have my clean gloves on, I'm going to go ahead and clean the area. This is also a good time to have the patient hold a mirror and watch you clean the area, measure the stoma, and kind of learn how to do it themselves. So first I'm going to start by looking at the stoma. Now that it's open and we can see it, I'm looking for any breakdowns in skin integrity, so any redness or any irritation or discoloration of the area. I don't see any. It does look good. So I'm going to take a washcloth with warm water and just gently clean the surrounding area here. And once I have cleaned the area, also sometimes it can bleed if you just hit the stoma a little bit during this procedure, which is normal, a little bit of blood. And now I'm going to go ahead and pat the area dry. I want to make sure that the area is completely dry so the bag sticks as it should. Once I have cleaned the area, I'm going to go ahead and use my ostomy ruler and measure the area. Okay, so once I have it measured, I'm going to go ahead and use the ruler to put over my colostomy bag to measure. So I would just place it over and trace the area. And I would also want to actually cut it 1/8 inch bigger, because I want to make sure that it's not too tight, because that can cut off circulation, and not too loose because we don't want it leaking. So once we have the proper measurement, we're going to go ahead and remove the sticky backing and the paper tape. And we can also put some skin adhesive around the stoma at this point to help the colostomy bag stick even better. So once we have the tape removed, we're just going to gently place it over and then firmly press it onto the abdomen. And the patient's actual own body heat will also help this stick better. And we can also have the patient help hold it to secure it as well. So ma'am, will you just go ahead and hold this here? And while she's just holding it, making sure it's securely stuck to her stomach, I can also make sure that my bag is clamped and closed. And once my bag is placed, I'm also gonna check for leaks. I don't see any leaks with the new bag. And after that, I will go ahead and remove my gloves, perform hand hygiene. I will put my patient in a position of comfort, and I'm going to go ahead and document that we changed the colostomy bag and measured any contents if there was any, and notify the provider if there was anything that we saw that needed to be reported.